Healthcare has been at the forefront for many over the past year, bringing greater focus to the health of underserved groups in Arkansas, women in particular. 3 bills introduced in the current legislative session hope to create better healthcare options for these residents. Viktoria Capek breaks down the bills for us, why lawmakers say now is the time to make changes, and why some Arkansas women say the changes are long overdue.
I have here bills 1065, 1067, and 1069 that aim to fill some gaps for Arkansas women. That's gaps for new mothers and infants, gaps for those living in rural parts of the state, and even gaps in our bank accounts.
Have you heard of the pink tax? The luxury tax? Maybe the tampon tax? They're phrases used to describe the tax women pay for feminine hygiene products.
But it's not a luxury. It's a necessity, and it should be a right.
Lauren Grace Perry was appalled to learn her home state of Arkansas never tried to get rid of the tax for such essential items, especially after 20 other states already made the move. That is, until this year.
50% of our constituents are women, so I think we should think about them.
Representative Aaron Pilkington is responsible for filing House Bill 1065 to exempt feminine hygiene products from sales and use tax.
By doing this, we can, I think show women in Arkansas that we understand, that they shouldn't be paying a tax that only they have to pay.
Perry says for a lawmaker to come forward with this legislation is a huge step in fighting poverty for women.
If you are homeless, if you're low income, if you're a college student like me who's on a budget, those couple cents add up.
This isn't the only bill Pilkington filed on behalf of Arkansas women. House Bill 1069 asks permission for pharmacists to give birth control to women 18 and up.
With the lack of providers we have in the state, it's really necessary to use as many players as we can to help fill those gaps in need.
Pilkington says this bill is all about accessibility, lowering unwanted pregnancies, and getting abortion rates down. The last is House Bill 1067 to create a breast milk bank in Central Arkansas and a special fund to support it. It's a big deal to infant care and lactation specialist Nicole Fletcher.
As a doula, I have clients often that are in search of, donor milk. And so it's kind of been like this quote unquote black market situation where where women or birthing people will connect with someone else that maybe has an oversupply, and they're just kind of undercover trading milk.
Representative Pilkington says close to 800,000 Arkansas dollars go to breast milk banks out of state every year. Building a bank here would cost close to $1.3 million. The offset in costs expected to pay for itself over time.
The closest one is Texas, but there isn't one in Louisiana or Missouri or Oklahoma or Mississippi or Kentucky. And so there's a lot of surrounding states that could definitely use our bank.
And Fletcher says access to breast milk is essential for infant care, an especially important point as Arkansas ranked last for infant care in 2020, according to United Health Foundation.
The more we have access to human milk for humans, the better and the healthier we will all be as humans.
Pilkington says being a male Republican lawmaker shouldn't matter when it comes to asking the state for better health options for women. What matters is bringing the best quality of life to all Arkansans.
I'm very confident about these bills passing. I think they're good, solid policies that my party can get behind and is supportive of it, but I also think the other party can get behind as well.
This is a huge step forward for women all over Arkansas.
All 3 of these bills have working committees and other supporting lawmakers, Austin McCullum and Breanne Davis, to name a couple. Now they wait for the state house to vote on the bills before anything else can move forward, and that is expected to happen in the coming weeks.
Right, Victoria, thanks a lot. And while the creation of a breast milk bank in the state is being discussed, Baptist Health Medical Center has opened the first nonprofit milk depot here in Arkansas to collect donations from women. Breast milk will be shipped to the Mother's Milk Bank of North Texas, where it will be pasteurized and made safe for babies before it's available to distribute here in Arkansas.